Lascan Corla. I welcome the opportunity to address the House on student nurses and midwives on behalf of the Minister for Health, Minister Donnelly, and he has advised that he cannot accept the Deputy's motion and accordingly asked that I move the Government's counter-motion on the continued commitment to the education programme for our student nurses and midwives. I want to pay tribute to the nurses and midwives and all their healthcare colleagues who have continued to deliver care right across the system during these unprecedented times. The past 9 months have demonstrated more visibly than at any other time in our recent history the dedication, skill and commitment of our healthcare workers, and I am acutely aware that this was not without risk, particularly for everyone on the front line. There are currently, as of the 31st of October, 39,608 whole-time equivalent nurses and midwives working in the system. I want to explain to the House some of the notable differences between Surge 1 and Surge 2 of COVID-19, particularly in the terms of the response required. Currently, there are around 280 patients in hospital with COVID-19, compared to around 900 in April and May. In addition, it is estimated that there will be an additional 4,176 staff employed across the health service by the end of 2020, with 991 of them additional nursing and midwifery posts. Also, the absenteeism rate for nursing and midwifery is currently around 5.6%, which is much lower than the 9% rate in the first phase, which led to a workforce crisis. These combined factors have made a difference in managing Surge 2. Fewer senior nursing and midwifery staff needed to be redeployed. Therefore, those who facilitate the supervision structure for clinical placements have largely remained in their roles, providing appropriate level of supervision in Surge 2. During the first surge of COVID-19, it was not possible to maintain clinical placements for the undergraduate students safely. Given the emergency, the students were offered temporary healthcare assistant contracts as an initiative to provide much-needed support to the HSE's response to COVID-19. Given the late stage in the academic year of Surge 1, it was necessary to ensure that all students progressed to the next academic year. A mechanism was put in place so that students could gain clinical hours if they worked as healthcare assistants in appropriate care areas, for example, medical ward if medical learning was required for completion of a student's course. This was supported by the regulator, the Nursing and Midwifery Board of Ireland, by the HSE, the Chief Nursing Officer, Higher Education Institute and the Directors of Nursing in each area. Unnecessarily standing down clinical placements at this stage in Surge 2, when it is still possible to safely provide them, would have a significant negative impact on the students and their ability to catch up, gain suitable clinical experience. Clinical placements are scheduled throughout the year for each student, and with approximately 4,505 students to accommodate in all required areas, there is little room for flexibility. Nursing and midwifery offer an exciting and rewarding career. There are many options across a range of specialities for nurses and midwives on completion of their undergraduate programme. Recent developments in the profession in Ireland include safe staffing policy with evidence of positive outcomes for patients, staff and organisation. The enhanced nurse and midwife's role today, graduate nursing and midwifery students can, after 1 year and 16 weeks, suitable experience apply for enhanced nurse and midwifery role with a starting salary of €37,161. That does not include those allowances of premium paid that are also available. Advanced and specialist practice, where the policy of the development of the graduate and advanced nursing and midwifery practice provides a framework for graduate nurses to draw upon their undergraduate programme and translate their broad-based experience and knowledge into action. The recent commencement of the expert review on the nursing and midwifery is also an exciting development. It is expected to report with recommendations in 2021 and will be an important milestone on the evolution of the nursing profession in Ireland. We should be proud of the standards of education and practice that exist in this country. We have an excellent educational and clinical infrastructure for undergraduate student nurses and midwives. The purpose of the registration education programme is to ensure that upon successful completion, the graduate is equipped with the knowledge, understanding, professional attributes and skills necessary to practice as a competent and professional nurse. Student nurses and midwives are not paid for clinical placements in year 1 to 3 and for the first 3 months of year 4. This supernumerary status is critical for learning in complex environments and is the optimum clinical learning environment. This places students in the front line in a learning capacity additional to the workforce, fully supervised for certain periods during each of their training. This ensures that students can safely learn, observe to take part in the wide variety of clinical skills acquisitions required for qualification. The word clinical placement doesn't adequately capture the essence of what is required or expected of the students. Clinical placement represents 50% of the undergraduate programme defined by the regulator in MBI. Placements are essential for the development of skills, knowledge, professional behaviour and attitudes representing a key component in the undergraduate students' attainment of the competency to practice as a registered nurse or midwife. During each clinical placement, nursing students must achieve all domains of competence and all indicators at the stated minimum level. Levels of competence vary each year and move through a complex learning process from a novice in year 1. Learning through the exposure and participation in clinical care under direct supervision, to year 4, where students are achieving a level of advanced beginner competent practice under distant supervision. I now want to focus on some of the key benefits of the undergraduate nursing and midwifery programme, which is, as the government counter-motion points out, is the second to none. Our 4-year degree-level programme is one of the main reasons why Irish nurses and midwives are in great demand throughout the world. The move to the graduate programme has created opportunities for nurses and midwives to extend practices and provides the necessary sustained change to operate in advanced and specialised practice roles. To facilitate this, graduate nurses have access to educational programmes that are funded by the Exchequer at the foundation diploma, master's and PhD level. Paid study leave is also available. New graduates can continue to develop and acquire new knowledge and skills, applying evidence-based practice to real-world situations. This creates an environment that supports expanding scope of practice, and the available evidence has shown that this results in greater job satisfaction, better patient outcome and improved service quality. This year, €2.2 million was invested in new advanced practice posts. This will only create more opportunities to graduate nurses and midwives to work in integrated care environments. It also assists in responding to the increase in the complexity of healthcare needs and service reform. Advanced and specialist practice are daily demonstrating important impacts and outcomes for patients, such as timelier access to service, reduced waiting lists, hospital avoidance and better integration of service, to enabling nurses and midwives to practice to the fullest extent of their licence. Earlier this year, in response to the emerging pandemic, health sector management and trade unions, including nursing unions, convened weekly engagements focusing on the matters arising from COVID-19. This collaboration has also been a key in addressing many of the evolving important issues that were of concern to our frontline health workers, including PPE redeployment, occupational health and wellbeing. I want to pay tribute to the health sector, trade unions and management for this engagement, and today thank them for the important work. COVID-19 is still with us, and the Department and I are supportive of the management and unions continuing with the forum for as long as necessary. In March this year, the Department engaged with the nursing unions in the COVID-19 emergency that was impacting on student nurses' midwife placements due to take place between April and May. Following intensive engagement, the Department and the HSE put in place a temporary arrangement for student nurses to apply to the HCA roles with placement was suspended. This temporary measure ended in August. On behalf of the Government, I want to express my gratitude for the contribution made by these students in providing support to our health service in times of acute need. Yesterday, officials from the Department completed a review of the current placement accommodation and travel allowance for student nurses and midwives. The Minister is currently considering the output from the review and will outline his approach to this matter soon. It is likely that the further engagement with the trade unions will be required when this matter concludes. And in conclusion, I wanted to be clear that I do not underestimate the difficulties that student nurses and midwives have experienced in the past 9 months.
Thank you, Minister.
All right.
Thank you, Minister. Thank you.